some of these devices save people's lives, right? So our goal is to make money while trying to do the right thing.
Welcome to today's video talk in the context of the PA Angst Forum 2025. Today we're going to talk about a very interesting and very important topic that affects all of us. And I'm very happy to have Peter Pilavacci here with me. Pete, you are the general partner of the PA Angst MedTech Venture Capital Fund. You observed the developments in the health industry very closely, and there is some really structural changes taking place lately. Can you share a bit of your experience? How do you observe this megatrend health in your daily work?
Sure, Agnes. Well, thank you for the question. Look, in healthcare, there's a revolution going on. Let's start at the beginning, right? The population is growing. The population is aging, and sometimes the population is growing bigger. So these are massive trends. Around that, there's other, considerations like cost of healthcare. And the idea, of course, right, is for innovation to be an answer to these great challenges. On our side, clearly we see the population growing older, and with age comes health issues. You can think of heart problems, for example. You can also think, of the huge raising costs of healthcare. And then, one aspect that people see maybe less, right, is that there's less people in proportion of that want to work in that field. So in particular compared to the needs, right? So we don't have enough nurses and we don't have enough physicians. And therefore, the big challenge is for innovation to bring solutions in terms of cost, in terms of headcounts in this industry, and of course, at the same time, improve, patient outcomes.
All right, that's a very interesting development. We have all these trends within the health sectors that you mentioned, and at the same time, not enough people to work on that. Where do you see the opportunities from an investment perspective?
Well, from our side, we're a company, right, that invests in startups, right? And the very definition of what we do is innovation, right? So we want innovation to have, for example, a deep impact in terms of healthcare costs. And one example I can give you, right, is if you can get a patient out of the ICU or maybe not in the ICU, right, the cost savings are immense, right? So that's one aspect. Another aspect that I think is very interesting, right? If you need to treat a patient, to have 2 physicians and 3 nurses, and the supply of talented people is not there, right? It's very clear that innovation can help you take the spot of these people, So just don't get me wrong, right?
Make it more efficient.
Make it more efficient, and it's not stealing jobs, right? These people are not there, right? So we need actually technologies, methodologies that maybe help the job being done by 1 nurse instead of 3, because there's not 3 nurses, for example. Yeah. So this is also, a big area where, innovation and technology can play a big role. A discussion like this one, right, could not even take place without saying the word AI. And that's also a big aspect in healthcare. And let me just tell you a little word about this. So, think in the last 20 years, right, there's a lot of medical devices that became way smaller than they were in the past. And that allowed for the introduction of sensors, sensor providing data, and data being able to be, basically processed and used, right, for the benefit of the patient. And of course, software engineering and AI, comes into place. But by the way, everyone will tell you the word AI, right? In healthcare, it's incredibly obvious that it will help patient outcomes. There is one little problem today is that we don't know who's going to pay for the data, right? Because there hasn't been data in the past, right? To the extent there is today. So, that's a big challenge. A challenge that will have a solution because patient outcomes are going to get greatly improved with it, right? So, of course, people will want to pay for it. And eventually, of course, insurance companies will want to reimburse because patient outcomes are going to get better.
I see. So you say new technologies, innovation, that is really key within this segment of healthcare. Now, how do you give access to investors to these opportunities?
Yeah, thank you for that question. So, we invest in our primary area of focus is cardiovascular. We love this space. It's an incredibly dynamic space with a number of actors that, they're big names. And these companies are in a very healthy position. They sell a lot of devices, make a lot of money. To grow, though, they have to rely on innovative startups developing the next device, right? And, it's funny because, not later than yesterday, I saw on LinkedIn their R&D spendings, right? And, these guys are spending a lot of money in R&D. And yet, really to discover the next generation device, they have to go and buy assets, that are, from startups like the ones we invest in, right? That's what we focus on. We have a big focus on cardiovascular. We do also ophthalmology. It's also an exciting space, with no doubt. And, we have teamed with a group in the Silicon Valley called ShifaMed. And ShifaMed is a big group, 400 people with a huge cardiovascular focus. They have a beautiful track record. They have, launched 6 ventures and sold all of them very successfully to the big strategics. We work together with them. They are our principal source of assets, and, it's a beautiful partnership because, we invest with them. And certainly, they are big cardiovascular experts. But guess what? They need money to develop the device, right? So, and this is the beauty of the partnership. They work with a couple of VCs, right? We're one of them. We're a fairly new VC on the block. But, for us, it's an incredibly exciting partnership because we have access. And thank you for using that word in your question. We have access to fantastic assets, right? So that's really what we do. Again, maybe just to conclude, we love that cardiovascular space. It's a space that is in massive growth. And again, it's a space where the big players are fairly aggressive in every way. They're fairly aggressive distributing their devices, but they're also fairly aggressive when it comes to buying an asset that they absolutely want or that they can't afford to miss because the next company is going to buy it, right? So it's just a really good space to be active in. Again, we mentioned it early in the discussion, the GLP-1 drugs, right, is a big health revolution, and it will have fantastic impact, most likely on our generation globally. But and we're very happy about this, naturally. It's not going to change our market drastically, right? The people who use cardiovascular medical devices, sadly, are already pretty ill, right? So, it's not for young and healthy people like you and I, right? So, it's a great space to be active in. And, it has a true impact on people's life. We really see ourselves as contributing to reducing the cost of health, of making the job in the healthcare industry doable, right? And we know how overwhelmed a lot of these jobs can be, or overwhelming, right? And then, of course, some of these devices save people's lives, right? So our goal is to make money while trying to do the right thing.
Thank you, Peter. When I listen to you like this, three main or key words come to my mind. It's all about access. Your fund gives investors the access to the health revolution, as you named it, and that's, for me, the second key point. And third, it's really an opportunity to have an impact on people's lives. Very interesting. Thank you so much, Pete, for your explanations and for sharing your experience.
Thank you for the good discussion, Agnes.